You can begin, Dr. McGrath.
Okay, thanks, Tatiana, and welcome everybody. Thank you for joining us for another Spine Time. Today is a particularly exciting topic for me. It's back and neck conditions in kids and teens, and I think we're going to focus in particular on the spine in young athletes and athletics and young people. And joining us today as a guest, we have Dr. Katherine Yao. Let me just pull up her slide here. She's an assistant professor of clinical rehabilitation medicine at Cornell, and she has particular expertise in this subject. She's actually a former athlete herself, having competed at the junior Olympic level and at the Division I level at Yale in gymnastics. And she currently serves as a national team physician for USA Gymnastics, and is also the head physician for the Alvin Ailey Dance School here in New York City. We're also going to have Dr. Greenfield, if possible. I hear he's still actually in the operating room, so we might not be able to hear from him. But I think we'll have more than enough to talk about with Dr. Yao. Let me just get to our first slide. Okay. Dr. Yao, I'll let you get started with your slides, and I'm going to just jump in with questions that either I have or that come in from the audience. As usual, we'll be screening the audience for questions, so as things come up, let us know.
All right. Well, thank you so much for having me. It's great to be able to kind of talk about this topic here. And since I'm by myself, I can focus a little bit more on, my background and interests some more. So my specialty is sports medicine with a particular spin and niche in the pediatric and adolescent group. I do see both pediatrics and adults, but I particularly love the youth athlete. I find that treating them, you have to have a certain understanding to get good results, not only get the right diagnosis, but be able to get them to get better and succeed. And in order to do that, first is that you have to I understand that the youth athlete functions very different from the adult athlete, or they could be very similar. But in particular, a lot of times the youth athlete, they do see sports as their identity. If they are immersed in that sport, they are committed to it, and they are in their young life, it's one of the main experiences that they've had. So a lot of times, if they're spending a lot of time doing it, they personally identify with that sport, and that is, their career at that point in their life. And so if you kind of get in that mindset with them, you are able to communicate with them better. And then also just having good knowledge of the sports and their background helps a lot. It helps them trust you, that you know what you're talking about with them, and lets them hopefully take your advice a little bit better and stick with it. Also good to understand is just the culture of where the patient is coming from and where the sport is coming from, and just knowing how the practices are run, how they are being trained, how much training they're doing, so that you can adapt their kind of diagnosis and treatment to cater to their specific background. And you can go ahead and advance the slide there. So relating to the back and neck, I'll start with the low back. Something in particular I wanted to talk about that is extremely common in youth athletes is something called spondylolysis, which is a fancy name for basically a stress fracture in the very tiny bones in the back of the spine, which we see here in this slide. And it is in the posterior or backside of the spine, and it is particularly common, or comes up when there is stress applied there, and that comes with a lot of repetitive arching type of motions or twisting. Having my background in gymnastics, I actually had one of these injuries and know how it feels and the frustration it is to recover from it. But it is very, very common among youth athletes from probably, I would say, 8 to 10 years old, but teenage years are usually the most common, up until, the late teens. And there are certain sports where it occurs more frequently, such as gymnastics and dance, which is, the most famous ones for having these injuries. But you also see them very commonly in sports where there is also arching or twisting, like soccer, where they're twisting to kick the ball a lot, volleyball, where they're jumping and twisting to spike the ball down, track and field, particularly with sprinters, baseball players. Those are just a few other sports where it tends to be pretty common. And it's something that, physicians and coaches and parents should, keep in mind that is possible. So if a child is having back pain for, longer than a month, that is something that should trigger you to kind of get them checked out and make sure they're not having something more serious like a stress fracture here.
What are some of the things, Dr. Yao, sorry to interrupt. What are some of the things that would trigger you to get an evaluation for this? Because I'm guessing that this is something that gets missed a lot, and it's something that there's a delay in the diagnosis. So what are some of the warning signs that would trigger a parent to have their child worked up for this?
Sure. So yes, you're absolutely right. This is something that does tend to be missed a lot, and there is oftentimes a delay in diagnosis and treatment. And that is because first, kids are all over the place. They could have, back pain or knee pain one day and the next day be fine. And that is usually more common. So I would say I would watch out for if your child is consistently complaining of back pain for more than probably 2 to 3 weeks. That should start ringing kind of a bell in your back of your mind that, this is something that maybe should be checked out. A lot of times what happens is kids they sense it, but they don't necessarily tell their parent or coach or anybody about it until it has been a long time, or until it's so severe that they have to say, like, no, I can't play anymore because my back hurts. And that's often the first time a parent is hearing about it, being like, oh, how come? Like, what's going on? And often you'll hear, oh, I've been having back pain. And then the parent will ask, well, for how long? And the kid will be like, oh, a couple months, but it wasn't so bad, so I didn't say anything. So that is the unfortunate story of how it goes sometimes. And part of it is that kids put up with a lot and they don't know to speak up either. So I would say if you notice your child is sitting out from sports for any reason, or is mentioning having one specific part of body pain consistently for 2 weeks or more, then I would say it's a good time to get it checked out.
Okay.
All right. And I do have a picture of it on the next slide here. And this is just an example of what a stress fracture in the back looks like. And you'll see a nice red arrow there pointing to, I don't know if you can see, can you see my arrow on the screen? Probably not.
I can see it.
Oh, okay. So yes, you can see this red arrow pointing to this kind of bright patch in this kind of horizontal angulated piece of bone here. So that bright patch of white is where there is some fluid signal, or more so swelling in the bone. And that is basically indicating that there is some injury going on in the bone there, and indicating likely a stress fracture there. It is picked up nicely on an MRI of the back. And so often parents or patients will ask, like, well, how can we test for, this condition? And We have our traditional x-rays, we have MRIs and CAT scans. Those are the three most common scans to evaluate the spine and the musculoskeletal system. And what I always push for, which insurances sometimes really do not like, is if I am really suspecting this injury, I will push for an MRI to get the best look at this condition. I try to avoid x-ray if I can, just to avoid radiation in, a young child or a teenager, because sometimes we will see a fracture, but oftentimes we will not, and we are getting the MRI anyways. I found that most insurances are okay with it in the younger teenagers and the kids, but some insurances still, unfortunately, do give some pushback and require an x-ray first. And that is kind of how it goes.
So are most patients, are they coming to you first with these complaints, or do they already have an MRI because their primary care doctors or their pediatricians are ordering the scans?
So most of the time, because I do work with some wonderful colleagues in the primary care, they will usually send the patient to me first before any scans are done, so that when it works that way, it's nice because I can then pick which one is, going to be most fitting. But sometimes they do come in with scans already done, which shows, the diagnosis that we might be seeing. It's tricky in the kids particularly, sometimes when they come in with scans already done, because not every medical system and radiology center knows or has the right protocol in their MRI scanning to pick this up. There are some radiology centers out there that are catered much more for adults, and they will only get slices looking at discs, and will not particularly scan kind of the other portions of the spine, and it just will not show it. If that's the case and they bring it in, and if it's missing those specific portions we're looking for, unfortunately, I do end up needing to get another specific scan to look for these sections of the bones.
That's a good point. I run into that a lot, where patients are frustrated because they got an MRI and they think that it's going to be sufficient, but not everyone has the same protocols that we use as our standard evaluation. So that can be frustrating, but it's important to have the best view possible of what we're trying to look for.
Yes, absolutely. And yes, that's happened to me before, where it's terribly frustrating when a patient comes in and they say, I've had this MRI, it's been read as being perfectly normal, but my back hurts a lot. We don't know what to do. It's been months and months of pain. And then I take a look at the MRI and it's just missing huge chunks of where these bones are lying. And there's just no way that they could evaluate for it. And then we end up getting an MRI and it does show something there. So
one more question. So do patients, do they mainly reach out to you directly, or to, a sports medicine doc directly, or is it mainly a referral through a primary care doctor?
So it depends on where they're coming from. Sometimes patients do find me directly. They will look online looking for a good sports medicine specialist, and they will, find a bunch of profiles and see my background and make an appointment with me. And that is one way that patients will reach out and to get evaluated. Sometimes they'll be referred by a friend or a family member, being like, oh, I had a sports injury. If you have an issue going on, why don't you see this person? And then in a lot of other cases, because patients don't necessarily know where to start with first, a lot of times, which is, the right thing, they go to their primary care doctor with a complaint, and then the primary care doctor then refers them over to see me for my specialty for that. And those are the two typical ways that patients reach out to find me.
Got it. Okay. that's a question that always comes up in the messages from the people watching. So I like to ask that just so everyone knows if they are suspicious that someone that they know has a problem like this, how best to get it addressed. I'm going to go to the next slide. Is that okay?
Yes.
Okay.
Oh, and then, so here I wanted to point out that point out a few really non-common things that practitioners may pick up that potentially could be more common than we think. Here, this is a rhythmic gymnast here, and it's just demonstrating the extreme kind of spine extension or the extreme kind of positions or things that youth athletes could be doing that we might have no idea until we really get into the details of it. And so sometimes we'll get athletes coming in with bad back pain, and we find out they do a lot of repetitive arching like this athlete here. And I did have a patient like this as well, where the traditional imaging and diagnoses, it didn't pick up anything. There was no stress fracture. There was nothing else that could be picked up. And this is one of the most frustrating things, is to have back pain or a pain in an area where you get scans and nothing shows up, yet you're still having terrible pain and there's no explanation for it. So this athlete actually had something called Bastrops disease or kissing spine disease, which is a soft tissue inflammation and a bursitis in the back of the spine. It is a known condition, but it is actually known to happen in older individuals, say in their like 80s, which is most common, and not particularly known to happen in youth athletes or young athletes. But that's also, this is not the normal activities that most people are doing, but that goes into having to get to know the details of the training that your patient is doing. If you know they're doing something very repetitive, they may be, having an injury that is less common. In a particular group, I find that dancers and gymnasts actually do tend to have this injury more common than we think. And so it's something where someone with knowledge of that particular sport might be able to pick up on it more easily and quickly to be able to help treat that condition. I have an image of it on the next slide, I believe, if you advance. So yes, here is a spine again in a slightly different sectioning. And yes, what you can see is between the spinous processes, or I call them the dinosaur bones that stick out, in the soft tissue between them, they are gray up top, and then you see a nice bright white splotch here and the two levels below. And that is indicating that there is some fluid or swelling in the soft tissue there that normally is not there. And so in her MRI in particular, everything else looked well and normal. The discs were fine. The normal, agents were good. And this particular finding, radiologists also may not be used to looking for when they are looking at a younger person's spine. So, sometimes we have to be very specific with radiologists to mention, like, please look for bursitis in these particular areas, or Bastrops disease, because they are probably more prone to getting it. And if you kind of indicate that or look for that yourself on the images, you probably will be seeing this more often than we think.
This is one of those tough conditions where, your average doctor is not seeing this on a routine basis, and your average radiologist is not looking for this on a routine basis. And so it can be really important for patients and families to know that they can push to see someone like yourself who knows what to look for and knows these sort of exotic conditions that actually might be more common than we think, and avoid having your child slip through the cracks. So there really is a something special about having someone like you that sees these things all the time, looking at your films and evaluating the patient to pick up on these little cues that, 99% of doctors never see in their career and can go undiagnosed.
Yes,
But what do you
absolutely.
do for something like this? Is this something that you would treat in any particular way?
Well, it's a really tough condition to treat because it's just a soft tissue injury. It's not necessarily dangerous,
Mm-hmm.
but it definitely is painful for the athlete. So if it ends up causing them to, change the way they're doing a particular skill or competing a certain way that leads to another injury, that part becomes dangerous.
Mm-hmm.
But in treating this condition, usually the first step is rest, but unfortunately it's rest for a very long period of time in order to let that swelling come down. I think having that understanding of just how long it can take for it to calm down, if the patient is able to do it, that is, the best solution. Having understanding that it does take a long time helps with their frustrations and anxieties about having back pain, for sure. It lets them know that they're not crazy, that they
Right.
have this like back pain coming from nowhere that cannot be explained. So that part helps a lot. For people who do struggle with it and it just does not calm down on their own, we actually can do cortisone injections to that very specific bursa, that soft tissue spot that is aggravating them. We always try to avoid the injections as much as possible, especially in the younger patient and in the younger athlete. But sometimes when nothing else works, we are kind of forced to use it as a tool. And so I have done some cortisone injections occasionally to these areas, and I do use ultrasound to guide the injections to minimize the X-ray exposure that they otherwise would usually need to have it done under fluoroscopy guidance or X-ray guidance.
Got it. Okay. Another question that just came up about the spondylosis on the last couple of slides. What is your treatment algorithm for those patients that come to you and it looks like on their MRI they've got either the beginnings of or an advanced spondylosis?
Sure. So part of it depends on the severity. Yeah, go for it. Part of it depends on the severity of the spondylosis or the stress fracture that we see on the image. If it is say like a very mild swelling in the bone without an actual crack in it, maybe slightly different treatment strategy than somebody who has, a lot of swelling with a giant crack through and cracks on both sides. Mainly the treatment differences is the amount of time that we spend allowing this part of the body to heal. Also, the consideration of using a brace too for the spine. There are a lot of opinions about whether to brace the spine for this condition or not to. There is, with research, no clear or right answer to that. Where I trained the surgeons and the sports physicians, we actually did brace the majority of the patients there, but I know a lot of sports physicians and practices who do not. What I have found is that no, you do not necessarily have to brace the spine to allow it to rest. Basically, you need to rest it from a lot of repetitive arching or bending back positions, but also rest it from jumping and landing too, because that puts strain on that area of the back. But you do have to rest it for probably minimum 2 to 3 months, even for a mild case. And if it's a more severe case, possibly closer to 6 months. you don't necessarily have to brace it. What I find is when you do brace it, it actually keeps the patients more compliant with the restrictions. So sometimes it may seem that the bracing works better and gets them better quicker. In reality, it might be because it restricts them more from the activities, just jumping around, running, playing sports that they otherwise might cheat a little bit if they were not getting braced. The other fact is that I find that the kids, it's a pretty big brace that we use to brace them. We always expect that they are going to hate it. Somehow they adapt very well, and they find sometimes some comfort in it, knowing that it will help them heal. I think they also find some comfort in it that it kind of it shows outwardly to their coaches and their teammates that they are in fact injured. It kind of demonstrates that, I am not just sitting out because I say my back hurts. It kind of shows them like, hey, look, I'm actually injured. So, and it's a good sign for the coaches to like really lay off and not push them.
That's a really good point. I think it's really important to kind of advertise that this is a legitimate thing that I'm dealing with, and having a brace really kind of projects that if there's any doubt, and that can be really helpful for a young athlete who's trying to navigate their health and their sports career. Another question I had, and this is kind of personal interest to me. I was a rower all through high school and college, and I still struggle with low back pain, and I'm convinced that I have at least a minor spondylosis like this. Is there any indication that developing something like this in youth can lead to problems as an adult?
It can. It is the reason why we do want to try to catch this early and treat it early is if we catch it early, we can even catch these injuries before you develop a full fracture line, which means you just catch it when the bone is swollen. And hopefully, if we catch it then, we rest it, let the bone heal up without ever breaking fully. And then that leaves the spine completely intact and less likely to cause issues later on as an adult and when you're older. If we catch it late and it's already had that crack, and then if we catch it even later and it's cracked and then shifted, that heals up a lot more poorly, or is a lot more difficult to heal up if it's cracked but hasn't moved. What it leads to later on in life is a less stable spine, because if you have cracks on both sides, that allows the spine to shift at any point. And that tends to happen when we're older with a less stable spine as the spine wears down, and it can set you up to have more back problems later on in life.
So if you have a young athlete, say, if you have a rower who's a freshman in college and they want to row through 4 years of college, or, a freshman in college who's a gymnast, and they come to you with this picture and they've got the beginnings of a spondylosis, not quite a spondylolisthesis where you've got those bilateral cracks, but kind of the early stages of this. Are there things that you can coach them to do, exercises or anything like that? Are there other stabilizing muscles that can help prevent this if they want to continue to compete as an athlete? They need a certain amount of rest, but is there a way to avoid this getting worse as they go through their career, or is it just something they're going to have to constantly battle?
So yes, we try our best to set the patients up afterwards to prevent it from happening again. And a good part of that is working on a lot of core strength. Once they have the diagnosis, I actually get them started in physical therapy and core strengthening right away. As they're resting from their sport and possibly being braced, I get them started in core strength to try to develop the muscles around the spine and the core stabilizing areas for the trunk, to get them ready to be back for sport for when their bone is healed up and they're ready to go again. So that's kind of, your abs in front, your transversus and your core muscles on the side, and the back muscles. What I find is most important too, in addition to just general strengthening, is doing or looking at the form and specific motions that the athlete might be doing that caused this injury in the first place, and making sure we fix that form that they might be doing a little bit more improperly, and making sure that they are strong enough to handle what they need, the motions that they need to do, so that part of the back doesn't keep getting stressed.
Yeah, that's totally a good point. Making sure that they're going through all the motions with good form, and that it can be tough because not all coaching is created equal, and it can be really important for athletes to be doing things the proper way biomechanically. And so being able to coach that and having some self-awareness as an athlete or a parent, I think is really important.
Yeah.
I'm just going to skip ahead to your next slide here.
Sure. So this slide is just showing I would say somewhat common, hopefully not too common, injury at the neck. We'll shift gears to the neck here, suffered by some athletes here, and it is called a stinger. And that is the kind of the nickname for it. And that is in contact sports. Basically, if you get hit really hard right at the crook of the neck, on either side, we have a bunch of nerves running through that area, and you could basically stun the nerves if you just whack it really hard and cause something called a stinger. If that gets injured, the patient or the athlete will have kind of almost paralysis or numbness or tingling, or just kind of nerves malfunctioning down that side of the arm. And a stinger is something technically where if you get injured, it's very momentary, and the sensation comes back within a few seconds, a few minutes, or maybe within half an hour, hopefully, and then returns back to normal again. Of course, more advanced or more aggressive neck injuries will have other consequences that we are always scared of, like a spinal cord injury or spinal fractures. But I did want to put this out there because I know that it is somewhat common and good to know about for athletes out there playing contact sports. I have seen hockey players, football players, anybody who's playing with a stick, like lacrosse players, get hit real hard there, and they come off the field with, really scared because their arm doesn't work, and then all of a sudden it does come back to life again. But it is something to take seriously, to make sure that they get evaluated fully before they are cleared to play again.
This is interesting you bring this up because, we were talking a little bit before the session started, and I mentioned how I work for the NFL on the sidelines of the Giants games as one of their evaluators of concussions on the field. And now actually one of the new protocols is that any athlete that has a stinger has to also be evaluated for a concussion, because they occur simultaneously so frequently, just because of the mechanism of the hits that cause these things. You said these people need to be followed. Who would follow them, or who would kind of clear them after a stinger?
Sure.
To go back?
So ideally, someone who is very familiar with treating neck injuries. So it could be someone like me, a sports medicine physician, also with the physiatry background, with good knowledge of, the nerves and joints. A primary care sports physician usually is very knowledgeable about it. It could be a spine physician who has a very good knowledge about the neck and the nerves, a spine physician like Dr. McGrath too, who, is aware of the anatomy and how this type of injury occurs and how to treat it. So I would say any doctor who has a good specialty and knowledge of the spine and the neck, and of sports injuries.
What are some of the more common sports you see this with? Is it all contact sports, or are there moves in gymnastics or dance or some of those things that can also cause something like this?
So most commonly it is in contact sports, because oftentimes it does need to take a hit to the crook of the neck, but not always. So I would say most commonly it is probably football, hockey, and lacrosse. But you can also get this type of injury from a big kind of stretch of that area. So you don't necessarily have to get hit. Your head could be hit, or something could get hit and push the two really far apart and cause a major stretch of that area. And that could happen in many sports in addition to those, like gymnastics. If someone falls on their head or shoulder just the right way, that could do it. I've had a hockey player not necessarily get hit there, but flew into the boards and had a stretch injury of that area, just the right way, and got it. So any fall or contact or trauma that can stretch or hit that area. And that brings a good point that you bring up about the concussions, that you're exactly right. If the neck is getting hit, most likely there's something injuring the head as well at the same time. So it is a very good idea to do a concussion evaluation with anybody with this injury.
Well, I think that's the last slide. I'm just going to look to see if we've got any other questions in the chat box. One question I had as you were talking is, you mentioned every different sport has got a different culture. I think that as youth sports get smarter and smarter about how to protect their athletes, there are probably more and more like resources for parents to look into. Are there any things like that you direct parents to for particular sports, or just in general to get advice about how to kind of manage their children who are young athletes?
So that's a great question. I wish that there was something more comprehensive overall to direct parents to for each sport. Each sport usually does have their own national governing body that usually have specific rules that they recommend that coaches and athletes stick to. So one thing is I would direct them to their national governing body. So if that were, and what I'm used to is USA Gymnastics, or it could be USA Track and Field, the USA Baseball League. They will usually have recommendations for coaches and athletes to stick to. And I know that there's a lot of work to be done more to protect the athletes and come up with more regulations and rules to better the training and protect them more. But I know that each sport is making an effort to try to do that. We don't know everything yet. They don't know everything yet. I think there's much more that we can do to protect them. So if there's any questions that is not clear or not addressed, a specialist like myself or you or anybody who is familiar with youth sports, I think is a good resource to talk to.
Have you noticed over the course of your career that there are changes going on in how youth sports are governed, or at least like the understanding of coaches and trainers or the athletes and the parents themselves? Have we been making progress in being aware of health and training and neck and back related issues in kids?
I think yes and no. I think there is progress being made, but it is being made probably very slowly and differently among each sport. Some sports are more progressive and have been doing a lot more to try to put more rules and regulations to protect injuries. An example is, the pitch count for baseball, youth baseball players. They put that in to try to protect upper extremity injuries. For the spine, I haven't seen any in particular recommended. I would like to see more of that in the recommendations for some of the sports. I would say we are relying a lot on coaches to have some knowledge of it. But in reality, we should be educating the coaches more so that because they're often the first eyes and, the people putting in the training recommendations. So I think that would be a good first line to make some gains in the knowledge and protect the athletes.
Yeah. Well, I think there's been a lot of progress in football around the concussion issue. And as a result, as you mentioned, there's been more discussion of how the spine is related to the head and how concussions often co-occur with injuries to the spine, or how rule changes that might be targeting concussion and trying to reduce the number of concussions could adversely affect other parts of the body, like the spine. So I'm hoping that some of that knowledge trickles down into youth sports and disseminates across sports, because I think we are getting smarter. It takes time to get the message out and to find ways of generalizing those lessons to other sports. But as time goes on, as you say, I think we are getting smarter. It's just about getting those lessons to the ground, to the coaches, to the parents. And I think sessions like this are particularly important to educate parents as to what they should be looking for in their own kids. Empowering patients and families, I think, really is the first step in protecting them. So the more we can do sessions like this, the more we can shed light on this topic. I think the more we arm parents with the knowledge to protect their kids. I have a young son and a young daughter who I know are going to be athletes. So I am interested myself in getting smart about all these things. So thank you for being here. I think that's it for the questions that we've had through the chat box. And I really appreciate you coming and talking to us.
Of course. Thank you for having me.
Of course. Thank you, everybody, for joining us. I think we'll be returning with Spine Time shortly. And as always, we appreciate your feedback through the channel. Any suggestions for new topics, any questions are welcome. We'll try to address them. And thank you all again for joining us. Enjoy the holidays, and we'll see you all again soon.
Thank you, Dr. McGrath.